Hello, my name's Danielle Carey, and I am a speech-language pathologist and an orofacial myologist with Emerge Pediatric Therapy. I'd like to welcome you to a new series we've started called I Spy with My Myo Eye. The reason we've labeled it this is because unless you know about something, you're never going to see it. So today we're going to start by talking about mouth breathing. I'm going to highlight some of my favorite reasons to breathe through your nose from an article called 28 Reasons to Nasal Breathe. The first one is that when we breathe through our nose, it warms the air to the optimal temperature for our lungs. My favorite reason, the second reason, is that when we breathe through our nose, we're bringing moisture into our internal system. We breathe through our nose about 20,000 times per day, and that's going to bring about 1 liter of moisture into our internal system. There are hair and membranes inside your nasal passage that allow for mucus to be released to prevent throat clearing and coughing. There is an antibacterial molecule that is released and triggers an improved immune system. It helps us smell the quality of the air and allows us to respond appropriately. That's super cool. Breathing through our nose cools the sinuses, which helps to regulate our body temperature. Breathing through our nose reduces anxiety. It can reduce the risk of sinus infection. Breathing through your nose can regulate sleep. Breathing through your nose also reduces the risks of snoring. It's really cool. There's lots of really good benefits to breathing through your nose. Now, let's talk about some of the orofacial implications of mouth breathing. As an orofacial myologist, my job is to make sure that all of our oral rest postures and our movement patterns are appropriate. So, if we are breathing through our nose, that means that our tongue is up in the palate, lightly suctioned. Our molars are 2 to 3 millimeters apart, and that's what we call the freeway space. Our lips are closed, and we're breathing nasally. Let's do that. Okay, so now let's take a minute and all of us open our mouths, breathe through our mouths 2 or 3 times, and let's notice the differences within our structures. Okay, so the things I noticed immediately are that my tongue falls to the floor of my mouth. The 2 to 3 millimeter freeway space we spoke about earlier increases greatly. And my lips are not resting apart. They are open. So let's break down why each of these things happening causes problems. One of my favorite orofacial myologists' name is Linda D'Onofrio, and she says that the lips are the face's braces. So think about it. Your tongue is on the inside of your mouth and it's slightly suctioned to the palate, shaping the palate and holding those teeth. On the other side of that are your lips. They're preventing those teeth from starting to jut out. And when they're not there, we have teeth movement. In addition to teeth movement, you can have lip incompetence, meaning that the muscles are not functioning the way that they should, and maybe we're having some feeding difficulties, maybe we're having some articulation problems. All of that can happen because of an open mouth posture. The next thing I want to talk about is the tongue. The tongue being in the floor of the mouth instead of up in the palate. So it's not shaping the palate how it should be, which is going to cause growth issues in children. And it's also not a neutral position for speech. So that's a problem. The last thing we mentioned about the open mouth posture is that jaw being habitually open greater than the 2 to 3 millimeter space we want to see. So what that means is that our teeth are far apart in the back. And what's going to happen is these top teeth are going to continue to erupt, meaning they don't stop once your adult teeth come in. If the freeway space is not appropriate, they will continue to come downward. Likewise, the teeth on the bottom will continue to come upwards if our freeway space is not appropriate. And what that's going to cause is a malocclusion or bite problems, which can lead to TMJ issues, among other things. So you're probably going to get a visit to the orthodontist to try to figure out how we can solve that problem if you are habitually breathing through your mouth. But we have to solve the root problem, the mouth breathing, to be able to fix all of the other problems. So those are just some of the reasons as an orofacial myologist why I don't want to see you breathing through your mouth. Now, let's take a second and think about why. If we're not supposed to be breathing through our mouth, why are people doing it, right? No one's doing it to, come see me or see other orofacial myologists. There's normally a reason. And those reasons include enlarged tonsils and adenoids. The tongue is pushing forward. They're just trying to open up the airway to get a good breath. Deviated septums. The sinuses and the passage in the nose are not clear, so they're breathing through their mouth for convenience. Allergies, again, it's hard to breathe through their nose, so they're going to breathe through their mouth. And even restricted lingual frenums. I'm going to show you mine. The line that you saw underneath my tongue is my frenum. Mine's kind of tight, but my palate is shaped appropriately. My tongue is resting where it should be, so I don't have any problems nasal breathing. Some people do. Some people have a restriction to the tip of their tongue. It's not sitting up in the palate where it should be, and they're not able to breathe through their nose. So then they get this host of all these other issues because our bodies are so interconnected and related. Another reason could be that as a child or in the past, something happened. Maybe you used to have enlarged tonsils or adenoids and they've already been corrected, but now we have this habit of breathing through our mouth. That's the easiest to fix. The structural problems are already resolved, and now we just have to retrain our brains to breathe the appropriate way. So that's another possibility. Let's talk a little bit about some tips to help promote nasal breathing. So in infancy, I know you've probably heard this 1,000 times, but tummy time, laying in that prone position is great to improve nasal breathing. Diane Barr mentions that in her book, Nobody Told Me or My Mother That. I recommend that book to everyone. It's great. Another thing you can do for older children is blowing activities. Now, bubbles, pinwheels, balloons, yes, all the air is coming out of our mouth for those, but what I like to do in those moments is educate the children. Oh, what's your breath doing? Where is it coming from? Making them more aware of breathing